Good morning. As you know, whenever we've issued guidelines in the past, we've based our decisions on the data regarding COVID-19 transmissions in our community. I promised that our health department experts would continue to evaluate the data and make decisions to keep our community safe, and that's exactly what they've done. I'm happy to tell you that the latest set of data on COVID-19 infections, which is available on our website at stlcorona.com, shows that the COVID-19 rates among children are going down in a general sense. Specifically, in the most recent 2 weeks, we see a sharp reduction in the rate of COVID-19 infections in the 15 to 19-year-old age group. The rate of new cases in this age group is still higher, but it's headed in the right direction. And I've talked in the past about my concern about the positivity rate in this age group. A couple of weeks ago, it was 20%. But more recently, in the most recent data, we see a positivity rate in the 15 to 19-year-old age group of 7.4%. This means more of those adolescents are getting tested, and more of those test results are coming back negative. Those are the kind of results that we want to see. We need to see kids continue to get tested, and we need to see, without seeing a dramatic increase in positive cases. Therefore, today I'm announcing new health department recommendations for school districts to allow middle school students to return to in-person learning. Also based on the data, we're going to announce some relaxation of restrictions on youth sports. So let's look at middle school first. The recent data gives us confidence to encourage in-person learning for school districts in addition to the virtual learning opportunities for middle school students. And this is only a recommendation. This is not a mandate. We understand that many of our schools have worked hard to create virtual learning opportunities, and transitioning back to in-person learning is complicated and difficult. And we're working hand in hand with school districts to develop a safe process for high school students as well. Because their case numbers are still higher, they deserve special protection, as do the teachers and staff who participate in their education. We expect new recommendations on that in coming weeks. Now to youth sports. Effective Monday, we are changing our guidelines to allow games and high-frequency contact sports for children under 14 and in middle school with some restrictions. That means sports such as football, basketball, ice hockey, and wrestling. Competitive games will be allowed for middle school and kids 14 and under. We will also allow all students, including high school students of any age, to play competitive games and moderate contact sports. This includes sports such as soccer, baseball, cheerleading crew, rowing, dance team, floor hockey, field hockey, lacrosse, and racquetball. For all outdoor youth sports, we will allow 2 parents or spectators per athlete to attend games, with an overall limit of 50. The point is to not separate children or parents, but the point is to make sure we don't have big crowds where COVID-19 can spread. So I want to say it once again. We realize that any limitation on youth sports is difficult for our young athletes, their parents, and their friends. To better capture the advice and experience from a wide variety of stakeholders, our health department has recently broadened its group of advisors. We're speaking with athletic directors representing public and private conferences, as well as medical professionals, youth and club sport officials, sports enthusiasts, and parents. And we're getting lots of feedback from everyone. We fully expect this broad group of advisors to help us take steps to improve the safety of high-contact sports among high school students. And although we are not permitting games and high-contact sports for high school students yet, such as football or basketball, we are actively working on a path forward that might include competitive games for those sports sometime later this fall. If we continue this downward trajectory of cases, positivity rates, testing numbers, and other indicators among adolescents in our community in general, we expect that in the next 2 or 3 weeks we can issue a document that sets up conditions for high contact high school sports to be played safely in our community. As always, our latest guidelines on youth sports are posted at stlcorona.com, and they've been posted this morning, and I'd be glad to answer any questions.
Thank you, Pace. Some may say in this situation that you could be, for lack of a better term, caving the pressure, whether it be from the protests, the lawsuit that was filed, the various people who have expressed concern about the restrictions on youth sports. You spoke about some figures there, some scientific evidence. Where's the motivation here? What's your thought process here on the motives to?
Well, I recognize we're in a political cycle, and every decision that's made in government will be framed in a political context. But we have continued to make decisions in the health department based on the advice of our public health experts, the advice of our medical community, the epidemiologists, and we have faced a great deal of pressure from the beginning, from our stay-at-home orders to our restrictions, several lawsuits along the way, protests along the way, and we respect and recognize the frustration in our community dealing with a historic event. This pandemic touches us all. We've had serious loss of life, hospitalizations, people who are sick with chronic medical problems as a result of COVID. People have lost their jobs. Businesses have been impacted, and this has hit everyone in our community. And we respect, we recognize the frustrations that go along with the restrictions that are required to keep people safe. We listen to the people who have concerns, and we incorporate that information and advice along with the direction from our public health experts, and that's how we make decisions.
How realistic do you think it is, Doctor, that we will see football at some point this fall in St. Louis County?
Well, we have to see the rates continue to go in the right direction among adolescents, among the group that has the highest rate of transmission right now. We have to be very cautious about activities that are close contact and allow for easy transmission. We're working with our athletic directors to create a safe environment. We've seen cases across our region and across the country with transmission among high contact sports, and we're sensitive to that. It's important that we keep the rate down to protect our high school kids and our middle school kids, and it's important that we keep the rate down not just to protect them as individuals, but to keep them from becoming a mode of transmission in our community.
What's the message you think this sends today with some of the easing restrictions, the possibility of middle schoolers going back? What's the message that you think this gets out there?
Well, we've had to make some tough decisions in St. Louis County, and it's left us in a better place. We've all made sacrifices across the board, all business sectors. Everyone has been touched by this virus in our community, in our county, in our country. Because of those sacrifices, St. Louis County is in a better place. Our rate of infections are lower than other places in the state and other places in the country. And the transmission rate, we're going to work very hard to keep that down and keep people safe and balance the impact of these restrictions on our community. They're certainly inconvenient. To some people, they are devastating as they affect their job opportunity or their business, and we're very sensitive to all of that. But we have to work through these. We have to respect how COVID spreads in our community, how serious it is, how it can lead to serious health consequences and loss of life, and we have to work together as a community to limit that spread as much as possible.
What is the difference between a 14-year-old 8th grader playing football and a 15-year-old high school freshman playing football?
The difference between the age group of middle school students and the age group of high school students is the positivity rate that they carry when they get together. And so the risk of transmission is a multiple of the likelihood that an age group is positive, and then the activity that they are participating in and the likelihood of transmission in that activity. So the reason why our public health experts have recommended different restrictions on those age groups is because of the infection rate among those different age groups.
So it's not so much the sport itself, but that age group and the positivity rate within that age group?
Well, each different types of sports, low contact, intermediate contact, and high contact sports have a greater likelihood of transmission based on how close they are and how frequently they are close. And that's why the health department and our experts and our advisors have recommended different restrictions based on the type of sport and have divided them into 3 categories based on their risk of transmission. And then the risk of transmission is multiplied by the likelihood of that age group having a COVID infection. And we know what that likelihood is by the statistics in the community of the positivity rate. And then we follow that very closely.
But Dr. Page, with respect, and I think what Caroline's saying is, as someone who's coached football, a 14-year-old tackling somebody is going to be just like a 15-year-old tackling somebody. Do I hear you saying that the concern is the overall infection rates at the
Yeah, all
age
of our
group?
decisions are driven by the infection rate in the community, the trend of that infection rate, and those rates of infection have driven the decisions across the country in most jurisdictions, and they've driven the decisions here in St. Louis County. What is the positivity rate in the community? What are the number of cases per 100,000? We watch that very closely, along with all the other data points, including the trends in hospitalizations, the death rate. There's a whole list of statistics that we monitor that you can see at sdlcorona.com. But the positivity rate, the likelihood of someone in an age group having a COVID infection is something that we watch very closely.
What do you tell parents of high school players who want to be on the field? Football players.
Well, I would have the same message that every group that is adversely affected by this pandemic. Everyone is impacted, everyone is struggling, and we're making tough decisions to keep people safe. And we are always going to make decisions in St. Louis County based on protecting the health and welfare of everyone in our community, especially kids. And those decisions are tough. Sometimes they're not popular, but we'll make the tough decisions to keep people safe, and we will also be very sensitive to how those negatively impact everyone in all business sectors, across all business sectors, and we'll work to find a way to move forward safely. Everyone is understanding starting to understand what they need to do as an individual to keep themselves safe and to protect others from the likelihood that they may be carrying COVID. We're seeing greater mask wearing in our community. We're seeing greater respect for social distancing guidelines and these protective measures. We need to all take them very seriously, because that's what decreases the spread of COVID in our community and gives us the ability to allow more mingling and more relaxing of our social distancing guidelines.
Was it the county health department that created the categories, the low, medium, and the high contact, or was that in consultation with the task force?
That was in consultation with all of our outside advisors. We've had those in place for quite a while. Okay. Doug, anything? Okay. All right, thank you.